All right. Well, now it's official, Tucker. We can start.
Is Neil not coming on? Or no?
It's Maria.
Are you the only one from Board of Finance?
Well, there's two others, but I show up. So, yeah.
Michael, I thought it was, well, Amy being the most consistent. I think Michael Chen is the other one.
And I think Maria Weingarten too.
Oh, it's Maria. Okay. They, Penny, as you know, they haven't been on any of our committee meetings. So,
Right.
But then again, this just goes from us to them, so they'll be there.
Yeah, I mean they'll have everything. So, so we can start the meeting. I think the point is to discuss the two proposals that were brought to the Board of Selectmen. One was for the Silver Hill, and the other for the Waveney telehealth. And Russ is here. If we have any questions for him, we could. And thank you for showing up. Appreciate that.
Hello, Russ.
So you want someone to
so
start the questions?
Essentially it's an open discussion for. I assume everyone watched the presentations. They understand where this money is going and the purpose of it. But obviously this is an open floor for discussion, and then ultimately, like we said, we hopefully just take a thumbs up, thumbs down, and move it to the Board of Finance.
Well, I had the chance to listen to it, and I always sit there like Joe skeptical, going, can we really afford this? Is what we should do? I was impressed with both of these presentations, and from my perspective, it really ties in with the purpose of ARPA. I mean, on the one hand, we're trying to expand kind of the telehealth and connectivity of people in our town to healthcare in a way that COVID exposed that we could do that we never thought we could before. And I had a chance to talk to Leo Carl. I almost called you Russ, but I grabbed Leo instead to just understand it a little more deeply. And one of my concerns was, and this is when we talked about initially, is like, if we're going to put something into a program, we wanted to be able to contribute it once and then it'd be standing on its own, which is, I think, what we have with the Raveney. They're not anticipating additional support going forward if they pull it off. The Silver Hill project, I think it's a little more open-ended, whether it might need support going forward. But as I think about it, the need they're trying to get is really, health.
Amy, I might be able to answer that.
Let me just finish what I was going to say.
Yeah.
Even if it did, to me, and I know there may be options of other towns, that would almost speak to its success.
Mm-hmm.
So it would be like we're reaching a lot of people. Hopefully it could be largely self-supporting, but it just might reflect really meeting a need that's not being met now. So I guess that's kind of my thought on those two.
Yeah, and Lauren Patterson from the Community Foundation, she's been part of this process since the beginning, and this is obviously one of their goals is behavioral health and that kind of thing. And she has indicated that the Community Foundation, just letting Kim in, Community Foundation would like to set up a fund to support this sustainably.
Right, and I believe if you all saw in the paper today, that was discussed because this was on the front of the advertiser talking about exactly that point. So, my viewpoint is, as we try to figure out the avenues, the main arteries, if you will, for how ARPA should be spent. Obviously, health. These are two of the biggest health issues coming out of, the post-pandemic, if you will. So, to the extent that we're helping the citizens of this town directly, then it probably is a worthy cause. I do hope that these, especially the Silver Hill, receives continued funding through the either the Community Foundation or other avenues like that. So anyway, those are my thoughts right now.
If I may, I would like to ask a question, Russ. With regards to the network telemedicine initiative, do you see the residents in the community going through your website to reach to a medical provider?
No, not at all. This is going to the individual who has comorbidities, setting up a telemonitoring, telemedicine unit with them. They would sign off on where their data went. So if they want their data to go to a specific physician, then their data would go to a specific physician. So we'd work with the doctor if they have congestive heart failure, if they have long COVID, if they have blood pressure issues, if they're high risk for stroke, then we're going to set up the program to monitor those items. So for congestive heart failure, as an example, they would have a scale that they would step on every morning. Instantaneously, that data would be uploaded into the system, and that system would say that, yes, they're within normal limits, or they're starting to retain fluid, and therefore we need to reach out to a physician and let them know that they may be at risk from a CHF standpoint.
So is this something that you see residents that have been admitted to Waveney that you're following up on, or do you see members of the community at large that you would provide this equipment to?
Well, this is in New Canaan, as an example, we have people that have monitors on them currently, and they have a concierge physician as well. So they are receiving, the concierge physician is receiving data on an ongoing basis, which they love. They love that because they can monitor their blood pressure, make determinations if they need to change their medication. So this is not, we're not providing care. We're just providing the instruments and the technology so that their physicians can track their health over a longer period of time.
Is this equipment reimbursed by Medicare or Medicaid?
The equipment is not reimbursed by Medicare, and that's why we're asking for the grant money. We're not asking for an investment. I think as some people would quote it, we're a nonprofit organization. We can't have an investor. We can have a grant. So this money be used to buy the equipment. There is a provision under Medicare Part B where the nurse practitioner, if an alarm goes off, if a red line goes off, someone's blood pressure is outside of normal limits for a prolonged time, they start congestive heart failure, they start to add additional weight, then a nurse practitioner or a physician can contact, have that face-to-face interview over an interface like we are now, and that is billable under Part B, Medicare. But that dollar does not come to Waveney, that goes to the physician.
So if you don't have a concierge physician, a regular patient calling their doctor, you would provide the testing and the monitoring?
The monitoring, yes, and it doesn't have to be a concierge physician. We have a lot of physicians who are not concierge physicians.
Correct.
I'm using this as just an example because one of the questions I got imposed to me was, I have a concierge physician. Why do I need to have monitoring? I can call my doctor 24/7. Well, there's a lot of people that do not have a concierge physician that has a primary care physician, and sometimes their wait is 2 to 3 weeks before they can get an appointment to go in and see their doctor. So this allows us to monitor in real time, and if they fall outside certain limits, then it allows us to notify their physician to have that interaction.
And how many people do you expect that this grant would fund?
Well, when we sat down, and I don't have my page number, but we did a conservative demand analysis where we looked at, there are 1,351 people between the ages of 40 and 79, I think from March to March, who have tested positive for COVID. Right now, the research indicates anywhere between, for that age group, 10 to 30% having long COVID. So we would look at that population. We'd also look at the seniors that we know that are in the community that are high utilizers of healthcare. And we'd work with Health and Human Services to identify those individuals, speak to their physician to see if this is something that they would want to benefit from. So that would be free. We looked at that market penetration as being only 1 in 5. So we didn't have very, very large numbers for that. And the same thing, 1 in 10 for the populations that's 55 to 64 that also have 2 or more comorbidities or chronic conditions. So that's who we're really trying to help. right?
Okay.
We're really trying to help those individuals not to get in the way between a patient and their doctor, not at all. But when you go in, I mean, we all have seen our doctors for other illnesses and diseases. My doctor would like to know what my blood pressure is over an extended period of time, not for that 15 minutes that I go and see them, right? That doctor's wanting to know what my weight gain and loss is over an extended period of time, not every 6 months what my weight is. So for those people that have those chronic ailments and those conditions, it really allows you to monitor their care, their wellness, if you will, and be more proactive in their care and their treatment.
Okay.
You know, Russ, I see this. My mom lives at the inn. Okay, and she's just had 2 episodes in and out of the hospital. When you get to that very elderly age, that happens. And I see something like this would be such a tool. For instance, like if, and I know you work with the visiting nurses, like if someone was at the point where they were like, all right, maybe I'm going to do hospice care, but meaning like long-term hospice care, then you have all this monitoring, you have all the data. So when there is an episode, it can also help someone intercede to keep you from going to hospital and address it locally and, you know, kind of have a better quality of life. And correct, and just in terms of the question, it's actually an individual device. Nobody's logging onto their computer, right? It's
That
a
is
freestanding,
correct.
so it's easy to use, and then obviously reusable for other people. You know, when you don't need it, you.
That is absolutely correct. And another question that was posed is, go ahead, Penny, I'm sorry.
I was going to say, it's just, if it's supposed to be, you know, an exchange here, are you not interjecting yourself into the relationship between an individual and their physician? I mean, if their individual physician wants to know what the blood pressure is on a daily basis, then the relationship between those 2 people, it's a responsibility to get that information. I mean, and
Well, again, this is a technology that allows a lot of physicians to access the technology for the town of New Canaan at a 0 entry point. If you made it independent, as you're suggesting, Penny, that a doctor works out with their patient, that we want to set up this system that is not reimbursed by insurance, then that's going to be in the neighborhood of about $1,200 and a monitoring fee of another $20 to $50 per month. We're going in and identifying those that are at need. We're not inserting Waveney ourselves. We're providing the technology for those people who need it the most, and doing it in a cost-effective way.
at what financial benefit to Waveney? Because this is not a, you know, goodness of our heart kind of thing.
Well, yes, it is. So the town
I
of,
can't-
yeah, well, as you know, Penny, we do $4.5 million of charity care every year
I
out of
understand
the
that.
benefit of our heart, because that is our mission. But yes, we would like to see this program expand into other towns. And I think that's where some of the other confusion was. We would like to offer to other towns and have it generate revenue. So we like to go to Wilton Physicians, Stamford Physicians, Darien, and say, we have this program, we have this platform up, and for this amount of money, we'd be able to monitor your patients for you. That would be on a fee-for-service basis, absolutely. And we're hoping that that revenue would then generate a little bit of profit income. But we're looking at New Canaanites, and the New Canaanites we were looking at as a grant to be able to provide this for those individuals that are at high risk in this town at a 0 cost entry point. That is a major difference.
Maria?
I want to just add, it seems a little to me like technology looking for a purpose in a way, because I know like 5 years ago, my mother worked with her doctor and had the scale at home. She had the blood monitor, like the doctor would prescribe it because he had that relationship with her to get that information. Now I know we watch our health. We have our own blood pressure monitor, like, and it's very cheap. We have our own, you know, to test sugar. So it almost looks like a cool system that you would have to almost sell to people who want to monitor their health until they find a reason to go to the doctor. Is that what I'm?
Not at all, Maria. It's hard to describe, being inside of healthcare and having physicians and doctors and patients and residents who are at very high risk and need monitoring, right?
That's where I stopped.
We did not invent telehealth and said, okay, it's like, the person with the hammer, everything looks like a nail, right? The telehealth and telemonitoring and telemedicine is here. It's been here. People are using it. So we're just trying to take that platform for those that are in need. A lot of our own individuals that we care for in home care in New Canaan are at risk. We can't be there 24/7. They can't afford us to be there 24/7. This allows us to set up with their physician a way to monitor their health.
With them paying for it.
Well, no, their insurance will pay for it. But, I think it's certainly worth exploring. And Maria, as you were mentioning with your mom, my mom has like a pacemaker thing and all this stuff. And I think, correct me if I'm wrong, Russ, this is just the ability to have the information, and then it can be shared with whatever system someone wants it, Norwalk.
Well, ours was communicated wirelessly, like it went back to the doctor too.
No, I know. I think this just consolidates it. And I think it's cool. And I would say, if there's ways for Waveney to provide a service and get some revenues to offset their benevolent care, because it's a big number that every year, Waveney underwrites, because once you're in the system, they take care of you. I think that's a positive.
Why is that then government's money responsible, to provide that? That's my question. I mean, we're on the government side here.
We're using federal, we're trying to apply federal money from ARPA for health and safety things. And, I think caring for seniors in COVID, I think it lines up. And if it has an added benefit, I think that's a plus personally.
I can't understand the difference between if your doctor prescribes this, or I'm not sure, like if you were that high risk, wouldn't your doctor advise you to have this monitoring set up, and then it goes through insurance? It's not the third party getting involved.
So I think they might just have
who would set up the system and the monitoring? Yeah. Who would buy the equipment and set it up? Who would monitor it on 24/7, 365?
So this is a third party monitoring the information, even though, like, my mother had it go back to her doctor. You're saying the doctors only look at it every now and then, or?
No, what I'm saying is this is being monitored on a 24/7, 365 basis. So if someone is putting a pulse oximeter on themselves, taking their blood pressure, if they're doing it when they're not feeling well and they're having what they think is an episode or concern, they can put this on. It'll automatically upload itself no matter what time of the day it is with your information. And Maria, and we have employees that have this as well. They send their information to their physician. Their physician then calls them back the next day and says, I'm reading the information and data now, right? This is done in real time.
So someone would get if something funky happened in someone's data, then the nurses, or there would be some response.
There would be an
you don't have to make the call and try to
make the call. You do not make the call. There would be an instant response based upon our, yes, that's correct.
Yeah.
And is there a call center watching this, or is it outsourced?
There is. The bank that comes in has every client on there. There are algorithms that are built in, and if something lights up, is someone, as an example, some people run 120/80 as a normal blood pressure. Others run 110/70. You would have those normal limits built in by your physician and doctor and know, is this normal for the individual or is this abnormal for the individual? So all of those metrics are built in. And if it becomes abnormal, then that is when a nurse will be involved right away, because it is being staffed 24/7.
Is that
And
a way?
how's that basic data kept up to date? Does then the doctor's office have to input current test results?
No, not at all. So it is constantly monitoring, constantly reading, constantly recording, and the physician is notified when it falls outside of those normal limits only.
Russ, can I ask a question? In the presentation, you laid out the $800,000, 400 from the grant from town, and then 400 supported by Waveney. Looking at it, and correct me if I'm wrong, is it on an ongoing basis, the nurse practitioners and the nursing staff, so that's $350,000. That is an expense that you'll incur each year. The hardwares and software, that investment is the other portion of this money, but the ongoing cost is the 350. Is that number?
That's correct. And that's where you see the revenues coming in order to offset that. And we have individuals, that if this can get up and running, we know that we can get some grant monies to come in for it in order to keep it going. But once we get into year 2 and we break it out into other, as I mentioned before, other towns, surrounding towns, then that allows us to generate additional revenue to offset the costs for the free care.
Thank you.
And then if it was really successful, I'm guessing that you would on your own go acquire more hardware.
Absolutely.
This is just a start. We're basically potentially funding the startup hardware and all the soft costs and the ongoing maintenance costs Waveney's anticipating taking on in perpetuity.
That's correct. We're only asking for the one-time grant only.
Any other questions for
Was
Russ
the
before we-
grant, was the grant originally 250? Because I was looking on one spreadsheet, I thought it said 250, but you're asking for 400?
I was not aware of any grant that was at 250 unless it was limited scope in our discussions with the town,
Oh,
but
it
based
was just-
upon
yeah.
what it was at 400 with matching.
Maria, I think that was a placeholder when people were thinking, where you might put stuff. People were saying, we know maybe Waveney needs it. I don't think it was based on a.
And the last question, the people monitoring, are they like in another country? Is it that kind of thing? Or are they actually at Waveney?
No, you have to be located. Number one, you have to be located in the state and licensed in the state for which you are.
Okay.
So we would have to be a nurse, our nurse that is licensed in the state. Of
So
Connecticut.
do you partner with individuals that is that all set up, that relationship, the monitor center, the call center?
Yes, we have a nurse right now that monitors the care center. I mean, monitors the information as it comes through, and that RN is located at our home care office. And
what's the nurse to patient ratio? How many people would they be monitoring at one time?
Well, that's I'll give you an average. Average, it would be about 80 to 1 based upon the algorithms. Again, a lot depends upon what the chronic ailment is. Is it blood pressure? Is it congestive heart failure? That's really going to depend upon how many nodules, if you want, modes are going to be going across your screen that we're going to be tracking.
And so an alarm would pop up if it was, let's say you had a bunch of people, something, it was outside the parameters, it would pop
That's
up and
correct.
the nurse would pay attention to it. Mhm.
That's correct.
Yeah.
Shall we move on to the Silver Hill and have a discussion on that? So keep on a timeline here.
Hey, Mark, can I make a quick comment? And I got to jump off. I have another call, but really appreciate dialing in. I do a ton of financing in healthcare, skilled nursing facilities, lab, agency, and telehealth has been a big boom over the last, which has been present for about multiple years, but have really come to fruition. And I think COVID is put it into hyperdrive. I think if it's done, and I want to say this correctly, if it's done properly, if the right people are putting the infrastructure in place and support system, it could be wildly successful. It could also be on the other side if it's not done correctly. But I am a big fan. I think it's caught a lot of attention and respect, and I think it can be a very useful tool to support our community, but it has to have the infrastructure if done properly. So my 2 cents, again, this isn't my place, but I was really appreciative. Maria is the one that alerted me to this meeting. I took it partially on the train. I have another call, but big fan, think it could be huge and wildly successful, but it has to be done right with the appropriate infrastructure.
Thank you, Luke.
Okay, so again, if no more questions, maybe we'd move on to discussion about the Silver Hill proposal for 250,000. And then after discussion, we can, make a motion to and then finish up. So any, you again, we don't have any representation here, but I assume everyone watched the presentation as to what that money is being used for. And it appears to be for New Canaan residents, and it fills a gap, a needed gap in the post-COVID world. So I'll leave it there, and any discussion.
If I may, Mark, in
Yes.
listening to the presentation and being aware that I believe that the town pays through the police department to have somebody on call in case there's any need for behavioral health assistance. I don't remember what that amount is, but I don't know if this will expand, or is this supposed to cover a resident who doesn't have insurance, or the difference between what insurance will pay or not. I'm not clear on what exactly the 250 is for.
I and Tucker can help, but part of it is to allow the staff of Silver Hill to gives them time, resources to take calls and assist residents in the behavioral health on those issues. So I think it's open to any resident, Christina, and correct me if I'm wrong, Tucker.
That's correct.
It just allows them. It's essentially a grant similar to Waveney to allow and give their staff the ability to service residents.
Yeah. And fills the gap that insurance might, if you don't have insurance, or that insurance might not cover. And
but they would still bill insurance, so that the 250 would stretch out more to cover the deficit. Is that true?
Yes.
that's
So
how I understand it.
and we're actually hoping that, we'll have some other partner towns to join in on this with us.
Mhm.
Kevin's had some very robust conversations with Darien and Wilton and Richfield. The superintendent of Wilton is very interested in this. And, my understanding, and I've sat through a lot of these meetings, but my understanding is that currently, if you find that you have a loved one, a friend, or whatever that's in crisis, and something happens that warrants them either going to the emergency room or whatever, you can sit there for hours, if not days, before you get any kind of help. They obviously would stabilize you, that kind of thing. But after that point, you're sort of given a brochure with a bunch of numbers and told, go home and start making these calls. This would allow for the warm handoff. A professional would call another professional and say, I've got XYZ client coming in and she needs some help here or there. And then we would have that navigator role, which is in-house, which is a role that Bethany Zaro is already filling in that department over there. They would then follow up and make sure that you're continuing to get the care. But as far as the finances of it, the nice thing about this, that in my understanding, is, we're already getting the benefit of the hospital already existing, right? So this is going to be for the hours. We're talking, 6 days a week offering this service. It's a 3-hour assessment. That is that's a good start. That's starting the treatment program right then and there.
Yes, but I do know that Silver Hill many times is totally filled up and that they
No,
can't.
this wouldn't
anybody
be,
else.
this would not be an intake to Silver Hill.
Okay.
No.
Okay.
I mean, if that's what someone might need, then the family could make the decision to, and Dr. Gerber explained that, they would always find room for somebody that was really, they would never send anybody home who was in that kind of a situation where they needed to be institutionalized. But,
Okay.
and maybe that's not even the right word to use, but you know what I'm saying. But
Yeah. Okay.
no, this
I-
isn't, this is not an intake with Silver Hill. This is just Silver Hill's expertise.
I view this as a sign that the town cares about this issue, and we're encouraging residents who sometimes may shy away from stuff like this to come forward, and this provides a platform for them in a discreet manner.
And here's Bethany too, and Bethany's been very involved and knows how this would work. But as far as the insurance piece, some people, that stops some people from getting help right away. Not even if you have insurance, but when you start hearing about what the deductible is or what the difference is going to be, all of a sudden, when you make that call, you've got someone in your family or friend again who's in crisis, and you call a provider, and some of the time the first thing they ask you is, what insurance do you have? And you need help right then and there. And this would allow you to get that help right then and there. They'll deal with the insurance and the finances after, but we're going to get you the help. Yeah.
And I assume that they would
Immediately.
deal with domestic violence as well.
You name it. I mean,
all
they're-
all issues that
Okay.
the mental health.
Tucker and Beth, so, I think one of the barriers too, when you have a crisis, you don't even know where to start.
no.
And so if people know that you can call Silver Hill and they'll be there or they'll point you in the right direction, like I said, this, we don't know, they don't know exactly how it's going to work. They've got a good, template, and, it may be something, hopefully other towns get in, but if this is wildly successful, in my view, and maybe it becomes something we support in greater community going forward, that's just a plus. That just means we're helping people out, in really tough times. So, because most people don't know who to call. It's like, at least you know where to call,
Sometimes you don't even actually know what the problem is. You don't have somebody who can help you. A parent may think their child's suffering from one thing, but a professional would say it's not that at all. It's actually a different problem. And here's where you need to go to get that help. And then Bethany and her team will follow up, within a few days to say, how's it going? Have you made any follow-up appointments, that kind of thing. So as it was, I heard many times it was the warm handoff, but it was also just somebody saying they care and the follow-up.
Why don't we hear from Bethany?
You're muted, Bethany.
Mute Bethany.
She's working on it. She's on her phone. You're muted, Bethany. There she goes.
There we go. Hi, everybody. So this is where the disparity seems to be. We do have the resources. The resources are there. It's connecting them with the people that need them. In order to figure out who needs them, the family, the person comes forward, whatever that point is. It could be calling Silver Hill. It could be calling Human Services, mobile crisis, a parent calling mobile crisis. Wherever that starting point begins, that starter will know what the next step is. And that would be at Silver Hill, the assessment within 48 hours versus 4 weeks. So there's a tip-off, and that tip-off it can start from many angles. And every angle needs to know, that tip-off needs to know to contact Silver Hill. So we get that done. And then the assessment is done. We can figure out the insurance. Human Services can do a quick financial assessment. It's very user-friendly to see if they qualify. We will pick up whatever the insurance doesn't pay for that assessment. That assessment is crucial. It's crucial in terms of the roads that you take from there. It is definitely the trunk of the tree. So it's vital. And when you're in a crisis, when someone's in a crisis or a parent is in a crisis, to have that go-to is life-saving. It can be life-saving. So that
So
being
it greatly
said,
speeds up the process, right? You know, it greatly speeds up the
time,
assessment.
yeah, time is of the essence in terms of the client's sake, the parent of the client's sake. It just, I have been through it as a parent, and the floundering adds a whole nother aspect of what do I do? What do I do? And I know most of the time we focus on it's a parent with a child trying to navigate. It could be also, don't put that into the equation. Put an adult needing help. It could be life-saving, but this is where we're finding the disparity. The resources are there. All these entities are there, but it is an avenue. It's wherever that starting point is, we know to jump to the next step, which is Silver Hill. And that needs to be a jump. It's not like, oh, okay, well, on Monday, we're going to wait and see if there's a bed available. Well, do they need inpatient or outpatient? We need to know. We need a medical professional's assessment. And this is the jump to Silver Hill. And then this will start everything else going. So that's where the disparity is. That's what we're trying to close in on. And we think that this program will help.
Maria, you're on mute.
Question. Oh, Mark, I have my hand
I
up.
always start with a really good question and then I put myself on mute.
I love it.
I'm sorry, Kim.
Oh,
Was
yeah.
that you just-
I had my hand up. I don't know if Mark saw it or not. I have a question, a couple of questions. Does this cover adults and children? How do you determine, is it first come, first serve? I believe is it 5 people a month? And then what is the rate that Silver Hill is charging for the assessment so that we can see, what we're paying for ARPA for that assessment?
It has a list price of $1,200
For the assessment.
for the assessment. And they're
And
hoping
there-
2
yeah.
a day, right? 6 days a week, Bethany?
Maximum, this is what we're anticipating based on informatics of what our area. This is for the pilot study. So yes, that's what we're, a couple intakes as I don't know if I just, sorry, I apologize for coming in on this, but it's 24/6. It's not 24/7. We'd love to see it 24/7, but at this time, Silver Hill feels they can accommodate 24/6 in terms of staff. And the age spectrum. The age spectrum is most likely this happens during, middle school, high school, and up.
That's what
So
I was
there-
going to ask about that. Sorry.
Yeah,
Are they
middle school, high
qualified
school,
to
and up.
deal with latency age children, like elementary school children? And who would be doing the evaluations? Like, what is the credentials of the person that's evaluating?
So that would be Silver Hill in terms of, medically qualified, licensed. And I don't mean to speak out of turn for Silver Hill since they're not here, but from what I understood, it's a psychiatrist that does this assessment.
So do you think all the other town, like Kids in Crisis, will refer to you? Like, is that what you're thinking? You'll pull Because if someone's having a crisis in school, they're going to go to the school office. How will people find, to know to call directly to Silver Hill?
To Silver Hill. So that would be part of the outreach in terms of explaining the program and how you would call. As part of the human services, I'm on call 24/7, but from 8 to 4, we have, the phone number. But let's say police came on site as a first responder to something. They have my phone number. They have my cell. They call me 24/7. I could get this going at Silver Hill. Whatever it takes, the connection is there, and we would make sure whatever entity is the point of intake, that it would lead to Silver Hill. And we do, with the first responders 24/7, that would definitely, from that point, they have my contact, they have Silver Hill's contact, EMS, things like that. It's the first responders that would do the 24/7 aspect, but then during the day, things like that. Kids in Crisis, they're one of our largest grant recipients for human services. We work very closely with them. So everybody knows how to get a hold of everybody, and we would make sure of that for the sake of the client or the potential client.
And Kim, if I can just add, each assessment includes a psychiatrist, a medical evaluation by an RN, and then case management and immediate referral by a social worker, PhD type of person, and then a next day follow-up.
I think this sounds really needed given the mental health crisis in our community and all over the state. One of the things that is, I think, important to think about is the confidentiality aspect of this. So when a client, is referred to Silver Hill, is it clear that the town will not get any more information about that client and that their confidentiality is with Silver Hill? Or how does that work in terms of that privacy issue?
So that's part of the gentle handoff aspect. If the client, it depends where the client starts. If they started at human services, we have them sign a confidentiality statement. In the event that we had to contact another entity, we would make the client aware of it, ask their permission, and then move forward. Silver Hill would do the same thing. It is really transparent in terms of the parent or the client, the patient, so that all along the way, the transparency for the client, patient, child, it is made aware of. And we have to. It's just legally, we would have to do that.
In the interest of time here, I think, this is going to go before the Board of Finance, and we're going to have another crack at it. So I don't think we need to dig any deeper here. Maybe someone can make a motion, and we'll vote and conclude, unless there's anything that.
Because I got a bottle to go feed.
I have to,
Come on, Tucker.
This is waiting.
all right, so
Mark, I make a motion to approve the Waveney Life Care Network telemedicine initiative for $400,000.
Second.
Okay, all in favor?
The motion is to move it forward, not approve the
Yes.
amount.
Yes,
To move it forward.
yes, to move.
Wait,
it
is
forward.
this telehealth or is this Silver Hill?
Now we're
gonna
going
No,
to
Waveney
do-
Telehealth.
we'll do
Yeah.
both. So Amy second, and now just a raise of hands. In favor?
Okay.
Okay, that's unanimous. And then we need a motion for the Silver Hill.
I make
I
a
move
motion.
it.
Okay, whatever. Yep.
And Penny seconds, and all in favor?
Yeah.
Okay. So Amy, it's now moving on to the Board of Finance.
And no, thanks everybody for doing the work on this. And, I personally think this is really a very positive way for the town to leverage these ARPA funds for things that are really in the spirit of ARPA and in filling a gap what we have. I think it's
Mhm.
great.
Great.
Agreed.
So can I make a statement, Mark? I just would like to request that we have another follow-up meeting, not where we're looking to move anything forward, but just to sort of get grounded in, how much is going through the New Canaan Foundation, how much we're looking at, where are we,
Right,
with
right.
the amounts.
Well,
That would be very helpful.
Absolutely happy. Yeah, we can schedule meetings. I mean, these Zoom meetings are very easy to
Yeah.
discuss. The only thing I can say on the New Canaan, the foundation, Maria, is that they're currently in the process of vetting anything that is super large. The town is taking on. In this case, these are examples of that. Whereas the small, like we're talking about $5,000 nonprofit grants that the New Canaan Community Foundation is vetting it. That'll eventually come to us as well, and we'll have a meeting just like this.
But what amount, what is their total amount? Like,
I don't have an amount.
They don't have an amount because there could be, Maria, for an example, the Community Foundation, and I'm just going to give round numbers to make it easy. They could have $1 million that have come to them, but they may then say these things don't meet we can't support this. This isn't in the guidelines that the town gave us and they're going to vet that. Let's say the number comes to us and it's a $500,000 cumulative number. That then, at this point, we don't have that number. They're in the process of vetting it. They have committees that are looking at, there's different avenues that they're looking at. There's, behavioral stuff. There's, other, there's probably 3 or 4, I think. Tucker knows them all, but
Yeah.
it's just too early to, we don't, they have, information that they, at this point in time, we couldn't really assess at this. So it's
all right, I understand that.
To pick up on what Maria's questioning is I think that it would be helpful if we would have another meeting where we are actually talking about some of the projects that are being talked about coming before us, because there are a handful of them that if they're not going to go anywhere for whatever the reason is, they should know that now.
Right,
so that they're not, looking in their forward thinking that they're going to receive that kind of funding.
They've all been communicated with. Anybody that's made an application for ARPA funds has been communicated with, especially the ones that went through the Community Foundation. They all know what the process is and what the timeline is. The others, the bigger ones that Mark referred to that the town is dealing with, my understanding is that, everybody knows we're in the process of approving those. So I don't think anybody's completely in the dark. Anybody that made an application doesn't know what the status is. I mean,
right.
if you...
I'm talking about the likelihood of it going.
Yeah.
Right. Well, I think
we have just found out that the lawyer has opined that the library doesn't qualify. So, we should, stop our conversation about it.
Well, that's correct. And but as an example, Penny, I think what you're hitting on, and Maria too, is if we all agree, we could, in our next meeting, that we think some money should be set aside for the construction of the new police department. That's something we can vote on. It still probably would have to go through. It still has to go through the normal channels. But if we all agree that $500,000 of ARPA should be set aside for the police department, we will certainly have that discussion. I think I think that's what. Yeah, and other projects that you're probably referring to.
Yeah, I mean, and I think we need to have, because Amy, you were questioning the Playhouse, and others have questioned the Powerhouse, and that came up during budget as well. And so I think, in all fairness to those projects, if we are of a mind that it's not going to go anywhere, it would be nice if they could be apprised at this stage so that they can move forward with other directions for their funding.
I agree. So we'll, so why don't we, perhaps when we get back next week, the schools are on vacation. I'm not around, but I'm happy to, do another one prior to our meeting on, I I believe it's the 20 something, but you
20th.
know, maybe that Monday or Tuesday we can do another meeting. If
Yeah,
you all-
I mean, it's just a, you know,
that's
in
fine.
fairness, people, I mean, I don't like, you know,
No, I
holding
agree with you.
But yeah, and
I
there-
agree.
out to people.
yeah, and these
I agree.
projects may be considered in a different light because, you know, money, it'd be ARPA money, it could be other money, but you know, whether it's art,
Yeah.
I agree with you, Penny. We put together stuff that we thought was appropriate. If for some reason people thinks it is not at this point, then we adjust it. So, all right.
Okay,
All
I
right,
like to be
so,
fair to
Mark?
people.
Have
Yeah.
a wonderful vacation.
Thank you.
Be back.
Thank you, everybody.
Motion
Don't
Okay.
come
to
back sick.
adjourn.
Stay
So
out of
moved.
the airplanes.
I'm unfortunately getting on one tomorrow, so
Mask.
I will. Okay, everyone have a great
Yeah.
evening.
Bye.
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 Thanks, all. Thank you.